This is, listen, I don't know that I needed to do this, but we have now a beautiful, significant, statistically significant, double blind, placebo controlled trial of that little old drug, the antiparasitic drug called ivermectin for COVID. Now, I know it's been a while, and so some people may be saying, David, why did you just pull this out of your ear? No. For months and months and months, the indifferent to the science right wing was aggressively promoting something called ivermectin to treat COVID. They would promote it prophylactically. They would promote it as an acute treatment for COVID. There were people like the candidate for Arizona Governor Kari Lake who claimed that she was just taking it prophylactically to prevent COVID. And my position was, listen, test everything. Test spinach, test niacin, test ivermectin, test whatever. But let's have double-blind, placebo-controlled, randomized controlled trials so we can accurately say these things do work for COVID or they don't. It would be great if we found something cheap and widely available, like apples or ivermectin, that was good for COVID. But unless we know that it works, it's irresponsible to claim that it does. And the right wingers said you're suppressing this and you're blocking that, and you don't want, they don't want the truth to be known. And the more and more data that came out, the more we believed it didn't really work. We now have a very good study, and indeed, the sugar pills worked better. Now, I want to be clear. The headline is kind of a joke, right? The headline is ivermectin worse than sugar pills. The sugar pills are a placebo, and what you have is almost identical effects between people actually getting ivermectin and people getting the sugar pill. So the headline's kind of a joke, but the truth is the ivermectin doesn't work. Study released 3 days ago, effects of ivermectin versus placebo on time to sustained recovery in outpatients with mild to moderate COVID-19, a randomized clinical trial. Okay, the key elements here, the question they were asking, folks, this is a science, right? This is how we figure things out. Question, does ivermectin daily for 3 days compared with placebo shorten symptom duration among adult patients over 30 years of age in the United States with symptomatic mild to moderate COVID-19? That's the question. Now, you can always come in and say they didn't dose it correctly. They should have tested 5 days. They should have tested it only on severe COVID or only on mild or in patients of 25 years. Okay, every test is only testing something. This is what this test is trying to figure out. And the findings determined that ivermectin should not be used in outpatients with mild to moderate COVID because it didn't do anything. Okay? When you look at design, setting, and participants, this is how we, folks, this is how we figure out stuff. This was a decentralized, double-blind, randomized, placebo-controlled trial. Okay? Decentralized means it wasn't all done at one location. It wasn't, okay, we're doing a test at this one hospital. Everybody who's part of the test has to be right here. No, it wasn't done that way. It was double-blind, meaning neither the patients nor the treating individuals, the medical professionals, knew who gets the sugar pills and who gets the ivermectin. It was randomized, meaning that there was not a selection of, okay, let's see, you three go in this group and then you four go in the placebo group, because that can then be affected by the bias of the experimenters who might consciously or subconsciously say, let's like put the healthier people in the ivermectin group because they're more likely to do well. No, it was randomized and placebo controlled, meaning some people got a fake drug, but they didn't know. Okay. It was designed to evaluate repurposed therapies, meaning drugs that already exist but are being explored for treating COVID, in outpatients with mild to moderate COVID. Okay, 1,591 patients, 30 plus, with COVID, with at least 2 symptoms and an acute infection less than 7 days old, meaning they were started on the trial before 7 days of COVID had gone by. Okay, very good. Participants were randomized to get ivermectin or a placebo. Okay, results. This is the most important stuff here. Okay. The most important things. The median time to recovery was 12 days for the ivermectin group and 13 days for the placebo group. Now you might say, well, look, the ivermectin group recovered 1 day quicker. That difference of 12 versus 13 days is not significant enough to prove ivermectin is more effective than doing nothing. The difference in the number of people being helped by ivermectin and the placebo is so small that there is not evidence that that 1 day difference is anything other than just chance. It's essentially the same. And in fact, it's really a range. The median time to recovery was 11 to 13 days for the ivermectin group and 12 to 14 in the placebo group. Now, importantly, what about more serious outcomes? Well, there were 10 hospitalizations or deaths in the ivermectin group and 9 in the placebo group. There were fewer deaths in the placebo group and fewer hospitalizations and deaths. Again, not statistically significant. So the joke is the fewer people died with the sugar pills. It's not a statistically significant difference. Now, let's say what would be significant in a group of 1,600 people with COVID, right? Imagine that only 10 of the people getting ivermectin ended up in the hospital, but 200 of the people getting the placebo ended up in the hospital. Then we would say, whoa, that seems very unlikely to be by chance. The ivermectin maybe was doing something. So the very clean, very, very good study. Now, some of you might be saying, why did we get that early data that ivermectin maybe worked for COVID? The best explanation we have for that right now is that ivermectin is an anti-parasitic drug. Some of the early populations at whom they threw ivermectin were in countries with a higher prevalence of parasitic infections in humans. The ivermectin treated the parasites, and overall, people do better, generally speaking, when they don't have parasites. So that would be the explanation of why the ivermectin may have shown a false signal at being effective for COVID in some very small early tests. All right, we have the data. We can put it to bed, except Carrie Lake still talks about how great ivermectin is. Quick break, right back after this.